Do you know what is Infection Prevention and Control or IPC? How to create a strong IPC system that helps healthcare workers to protect themselves and reduce the transmission of infections among the general population? Welcome to the Basic Training on Infection Prevention and Control or IPC e-learning module for the Ministry of Health and Family Welfare, Bangladesh. This module is designed for doctors and nurses. The module will take approximately 3.5 hours to complete. After completion of the module, you will be awarded with a certificate of completion. By the end of this module, you will know the importance of infection prevention and control measures, their applications, and effective IPC system in every healthcare facilities. This module has 6 mini modules that cover infection prevention and control and its components, infection prevention and control strategies for triage in healthcare settings, application of standard precautions, implementing additional transmission-based precautions, environmental cleaning in healthcare facilities, and implementing administrative controls. At the end of the module, you will have to go through an evaluation process for getting the certificate. Let's now begin with the first mini module, Infection Prevention and Control and its components. To successfully prevent infections such as the COVID-19 pandemic, you need to follow infection prevention and control strategies as outlined by WHO. At the end of this session, you will be able to define infection prevention and control, state the objective of infection prevention and control, describe the elements of standard precautions for infection prevention and control, and list the additional precautions specific to COVID-19. Let's begin with the definition of infection prevention and control. Infection prevention and control is defined as a scientific approach and practical solution designed to prevent harm caused by infection to patients and health workers. It is grounded in infectious diseases, epidemiology, social science, and health system strengthening. Infection prevention and control occupies a unique position in the field of patient safety and quality universal health coverage, since it is relevant to health workers and patients at every single healthcare encounter. So, what is the objective of infection prevention and control? The objective of infection prevention and control is to break the chain of transmission using standard precautions at all times. Let's now learn about the standard precautions for infection prevention and control. Standard precautions are the basic level of infection prevention and control and are applied to all patients in any healthcare setting. The elements of standard precautions as outlined by the WHO include hand hygiene, respiratory hygiene and cough etiquette, personal protective equipment or PPE according to risk, safe injection practices, sharps management and injury prevention, safe handling, cleaning and disinfection of patient care equipment, environmental cleaning and safe linen, and waste management. Are there any standard precautions that are specific to COVID-19? Yes, healthcare providers caring for patients under investigation for COVID-19 must follow standard infection control precautions, which include basic hand hygiene, the use of personal protective equipment, respiratory hygiene and etiquettes, and environmental disinfection. This brings us to the end of this mini module, Infection Prevention and Control. In this session, you have learnt about infection prevention and control, the objective of IPC, the elements of standard precautions for IPC, and the additional precautions specific to COVID-19.